All right, opposition, would you like to come sit here?
Thank you, gentlemen.
We'll take testimony from two people. Who is speaking in opposition? All right, please begin.
My name is Hezekiah. I'm with the Emerald Growers Association. We have been in an opposed unless amended position since early on to the author. And, staff, thank you very much. The amendments that you've made are a tremendous improvement. One of the speakers in support mentioned the word balance, a balance between local control and patients' rights. And I'd like to note that for the last 18 years, our, several tens of thousands of small cannabis producers and businesses have suffered with the regulatory uncertainty of this lack of regulation as well. And it's very important to bring, I think, the producers and the businesses' perspectives to bear as well. There's several challenges that remain with the bill. Most notably, we mentioned, or in the opening comments, the multi-agency versus single-agency approach and this very real conceptual philosophical conversation to be had. It's our opinion as farmers that California Department of Food and Ag is the appropriate agency to be regulating cultivation, and that cultivation of cannabis really is fundamentally no different. The product itself is different, and certainly we see the need for increased regulatory protections and enforcements above and beyond. But on the farm, this is a farmer's issue. And, when we talk about balance, it's very important to note that CDFA has not just enforcement, but it also has incentives. And when we try to bring our businesses into compliance with these regulations, which we very much want to do, the carrots will help, and access to the incentive programs will help. And having CDFA noted in the bill specifically would be a huge, really a fundamental starting point for conversation from our perspective as farmers. We remain concerned about some of the labor language as well. We remain concerned on the ban for prior convictions. A lot of our members have unfortunately had trouble with the law over the last several years, and we do feel strongly that if it was a nonviolent crime that will no longer be a crime, that they should be allowed to participate in the regulated system going forward. We also think it's very important to note that California's cannabis industry is unique in that we have tens of thousands of small producers, and acknowledging that and helping those small producers to transition will ensure an effective and expeditious transition to a well-regulated, safe, and sustainable industry, which is what I think that we're all after. So with that, I will yield and give the others time. But, once again, thank you very much. Your office has been very receptive, and we do look forward to working with you. But at this point, with so many bills on the floor, we have other preferences and would encourage we focus our attention there.
Thank you.
Dale Geringer with California Normal, one of the sponsors of Proposition 215, the Compassionate Use Act, and also involved in the 2016 initiative. And as we look forward to 2016, we think it's really important that the state try to finally address this issue of medical cannabis regulation. Prop 215 itself called for the state to do this almost 20 years ago. Well, but better late than never. We do have problems with this bill and also with the AB 34, but there's been, it's a complicated issue, and I see a lot of goodwill on the part of the authors to address the problems there. The specific issues that we noted in this bill, I think, have been addressed in part by some amendments Mr. Cooley's taking. So we withdraw our opposition. We still do think some more work needs to be done, and we are specifically concerned about this ban on people with prior marijuana convictions, which would disqualify a number of really eminently qualified and active participants in the and responsible law-abiding applicants now. In the current industry. But with that much said, we hope the legislature will take serious consideration of this.
Thank you, Dan.
Okay, others in opposition, name and organization.
Nate Bradley from the California Cannabis Industry Association. We're currently opposed unless amended. We've heard about some new amendments I've spoken with the author's office about, so we haven't changed it yet, but we look forward to working with them on some of the new amendments regarding state enforcement and the lack of it in this bill.
Okay, thank you.
Madam Chair, Eduardo Martinez, California Medical Association. We were opposed unless amended to. Want to thank you and your committee for your work. I think the authors agreed to accept amendments which would remove our opposition. Thank you.
Thank you. And for committee members, I think that's on page 24. Others in opposition.
Hi, Kim. Marcia Blount, President of the Brownie Mary Democratic Club of Sacramento County. We oppose unless amended. Thank you.
Thank you.
Lynette Davies with Crusaders for Haitians' Rights. We are opposed. We think that Bonta has a better option with the multi-agencies. Thank you.
Rich Miller with Health Education and Legal Patients' Rights. We're opposing this bill unless amended as discussed earlier. Thank you.
Thank you. Back to the committee for questions. Mr. Wood.
How did you know, Madam Chair? Just a couple comments and then a couple questions. First of all, appreciate very much the author bringing this forward. I will tell you I'm going to support this bill as I did with the Bonta bill because I believe that it's important for the conversation to continue, and I think that both of these are somewhat a work in progress, so I appreciate that. Do have as I mentioned in my testimony with Mr. Bonta, I am concerned because the Senate B&P has come out pretty strongly against the Department of Consumer Affairs being the agency. And as I checked with my staff, when Mr. McGuire introduced his bill, they offered no alternatives. So there is a challenge here that you're going to have to work through. But just so obviously you know that at this point. Couple things. I know there's a special account set aside for environmental enforcement. I know it's challenging to fund mitigation efforts, specifically on trespass growth. So I'd love to be able to work with you on that. Taxation, it's a hugely important issue. I'd love to see some of that money going back to the local jurisdictions where the majority of the cultivation is happening. Also happy to work with you on that. Get any questions? I think I had a question that I think Mr. Bonta actually answered pretty well about the EPA and pesticides, so I'm going to do a little more research on that. The two questions here. Cultivation sites, why the restriction to the site being 1,000 square feet? And the reason I bring that up is 1,000 square feet can look really different in my district versus the Sacramento Valley.
Right. Well, I think I can ask Mr. Cromartie to speak to that. In general, I think they're trying to limit the impact of this, commercial grows where you've got thousands and thousands of acres. So they're trying to tailor it to a specific fact pattern. But you want to...
The limitation to 1,000 square feet only applies in instances where you have an applicant who's trying to combine a cultivation license with a dispensing license. If someone is applying for a cultivation license alone, that restriction would not apply.
Okay. Appreciate that. And then my final question, issuance of provisional licenses. So will the regulations developed for the suspension, denial, or revocation include cases where the proposed licensee has knowingly or had caused previously caused environmental damage?
You want to speak to that? I have a view on that, but you want to...
We don't have that in the bill currently, but certainly the sponsors are willing to look at and discuss that issue.
Okay. I just want to say thank you again for your efforts here. I appreciate it.
Yeah, to respond, Mr. Woods, I think our job is to figure out what policy makes sense. And so where someone has been flaunting the policy, I think it's fair to ask to structure it to take account of that. On the issue of what agency, your comments earlier about having multiple agencies involved in the conversation, I do think, I actually started my conversation with Pro Tem De Leon on this issue last fall. I've continued those conversations, continued them with his staff. I definitely have felt a part of the chemistry of our collective efforts coming to a solution, we need to be having a senior level collaboration. On the issue of what agency, I do think that there's an issue here of what is the best way to set up an accountable structure, and one which the legislature can help keep an eye on in the future, and that division among different agencies concerns. So what specific agency? Open question. One or more is an open question, but I think institutionally we should have some concern. There is ample precedent for when you go into an area and the legislature looks to tackle a problem to establish a new entity that deals with that. And so I think it's up to us to figure out where we think we want to land, what makes the most sense. Trespass grows. I do think we need to have a funding strategy for dealing with the environmental damage. You have jumped on that. Of course, you see it in your own in your own district. I know we've talked about it. You've talked about that with your patients in the dental chairs, I do believe, as we have talked some about that. So you have a lens on that problem that is unique in the institution, or maybe with Mr. McGuire, and I think we ought to focus on that. And so with that, the whole issue of if there are taxes, how they get allocated, what problems we send them out to work on. We have to address nexus issues, but issues of environmental damage do cast a broader net than some things.
There's some more questions.
Yes.
Ms. Eggman.
Thank you. And thank you, Mr. Cooley, for working on this. I'll be supporting this bill today, and if it hasn't so been moved, I'll move the bill. And, this is an issue that applies across the state, and all of our communities look very different. And so I think this, as much as I don't frequently agree with Mr. Jones, I do agree that we maybe should have held both of these back and really put one package together about what's going to go forward, because as going now, at some point you're going to have to come together, and I don't know when that is, but at some point we can't have both of these bills continuing to go forward. It's a complex issue. I think it's going to continue to grow in its complexity as more and more issues come up and potential full-sale legalization occurs. So I think we really need to develop a framework that we can plug things into as they come up. But for today, I'll be supporting this and move the bill.
Yeah.
Mr. Dodd.
Yeah, I too really, in a perfect world, I'd like to see this, left behind and have us really work out the policy. I was able to talk to Mr. Bonta after the meeting. I laid off of his bill. I kind of get the sense from you that you guys are going to be perhaps working together, and that's how this process works. This is not a perfect world. So I will be supporting this bill and probably adding on to Bonta at the end, and with the understanding that the authors of both these bills are going to be working with on two things that are really important to me: local control and certainly oversight.
Yeah.
Thank you. Mr. Wilk.
I'm just going to echo everything that my colleagues have said. Commend you for taking this up. Certainly something we need to address. I voted no on the Bonta bill. I have reservations about this as well, because I'd like to see something more cooked. My largest city in my district is supportive and called me this morning, so I'm going to support your bill and would just encourage you to work with all stakeholders, and let's resolve this to the best of our ability. Thank you.
Mr. Jones.
Basically, just to confirm Ms. Eggman's comments, my preference is that both bills stay here in B&P so that we can work them out, maybe make them a 2-year bill or whatever, because I think this is the proper arena to do that. But short of that, recognizing that it may move forward, along with what Mr. Wilk said, recognize that you're going to continue to work. I'm going to lay off today, but look forward to us coming to some kind of conclusion soon, or however long it takes to do it right. Yeah, thanks.
Thank you. I had one question. You were talking about personal use, and then you had a second category after personal use, and I didn't quite catch it.
It's, let me find the language in the bill. It's personal use or providers who are caring for like work with 5 individuals. There's an exemption in the licensure provisions. And that's why I can't.
I can jump in.
So you don't allow collectives anymore.
Primary caregivers working with 5 individuals are exempt from licensure under this bill. So it's sort of the small-time individual or a primary caregiver working with just 5 folks. So we're not dumping a lot of red tape on that category of a person. Okay. So that's trying to make sure people who are benefiting from 215 don't have extraordinary barriers put in there.
That's a distinction, actually, between the bills.
Yeah.
That isn't in the other bill. I'm not sure. Okay. All right. I think we've almost exhausted the topic. I do think that, moving forward, there's several options for how we can all coordinate. Clearly, there's also a Senate bill moving at the same time. And hopefully your discussions will continue with Mr. Bonta on how to resolve. And, one suggestion, it's certainly not, it's just a thought. would be to separate perhaps all the cultivation and all the growing into one bill and, the dispensaries stuff into another bill. That would be one way perhaps to look at it. It would be a little less cumbersome and a little more focused, and get it into the proper oversight regulatory department it might need to be in. So that might be one thing to consider. I will also be requesting that once this bill travels its long road ahead, that it will come back to this committee prior to a concurrence vote. I think it'll look different, probably quite a bit different at that time, and we'll want to hear it again. And so thank you very much. With that, we do have a motion, no second. Second. Wilkes seconds. This is due pass as amended to appropriations.
We're good. Thank you.
Bonilla?
Yes.
Bonilla, aye. Jones? Jones not voting. Baker?
Aye.
Baker, aye. Bloom? Aye. Bloom, aye. Burke? Aye. Burke, aye. Chang? Dodd? Aye. Dodd, aye. Eggman? Aye. Eggman, aye. Gatto? Holden? Mullen? Ting? Wilk? Aye. Wilk, aye. Wood? Wood, aye.
8-0, the measure is out.
Very good. Thank you.
Thank you.
Thank you, colleagues.
Ms. Melendez, you're the next author. AB 333. It's going to be some kind of a lucky number.
My
Number
lucky
9.
Vegas number, Madam Chair.
Move the bill.
Thank you. Thank
We
you.
have a motion and a second.
Wonderful. I don't want to be presumptuous and just say I ask for your aye votes. I'll briefly summarize what this bill is about. This is regarding AEDs. It will allow medical professionals who are certified instructors in CPR and AED use to receive up to 2 continual education credits for volunteering to do this training. It doesn't create an incentive that would benefit both the instructor and the school, resulting in the school officials being more likely to utilize AEDs in the event of an emergency. I have Kathleen Weiss here, the CEO of the Red Cross Gold Country region, and I do respectfully ask for your aye vote.
And did you accept the amendments?
I absolutely did.
Thank you.
Good morning, Madam Chairwoman. I'm Kathleen Weiss of the American Red Cross Gold Country region here in Sacramento, and the American Red Cross does support AB 333. The American Red Cross is pleased to support AB 333, which would incentivize the training of K-12 school faculty and administrators in the use of automated external defibrillators by allowing individuals the ability to earn continuing education units. AEDs are used to treat the effects of sudden cardiac arrest. Each year, nearly 424,000 people experience sudden cardiac arrest outside of a hospital. Only 10% of these individuals survive. Encouraging school employees to be prepared in a time of emergency, including in the use of an AED, can save lives.
Thank you. All right. Seeing any in support? Seeing none. Anyone in opposition? Seeing none. Yes, we've moved it and seconded it, and it's a due pass as amended to approves.
Bonilla?
Aye.
Bonilla, aye. Jones?
Aye.
Jones, aye. Baker? Aye. Baker, aye. Bloom?
Aye.
Bloom, aye. Burke? Burke, aye. Chang? Dodd? Dodd, aye. Eggman? Eggman, aye. Gatto? Gatto, aye. Holden? Mullen? Ting? Wilk?
Yes.
Wilk, aye. Wood?
Aye.
Wood, aye.
10-0, the measure's out.
Thank you.
Ms. Burke, are you ready to present? Item number 20 on the agenda, AB 1306. Thank you.
Thank you, Madam Chair and members. We have nearly 1,200 certified nurse midwives practicing in California. And while most other states allowed certified nurse midwives to practice independently, we're only one of 6 states that require a physician supervision. AB 1306 allows certified nurse midwives to manage a full range of primary health care services for women within their existing scope of practice. I want to be clear on a couple points. First, certified nurse midwives are not asking to expand their scope of practice. The bill untethers them from physician supervision to continue to provide the same services that they have been providing for decades. Keep in mind, California law already specifies that supervision requirement does not require the physical presence of a physician. Actual oversight of daily care delivery, inspection of charts, or evaluation of patients. Second, we are working cooperatively with the California Medical Association to address their concerns. In fact, we've already reached an agreement on the consumer safeguards outlined in their letter. Before this bill reaches the floor, we will have added language to make it explicitly clear that certified nurse midwives are subject to corporate practice of medicine, bar, and self-referral and anti-kickback prohibitions. As you know, we've already removed physician oversight for licensed midwives. AB 1306 creates parity in the law for certified nurse midwives with all of the appropriate safeguards that consumers expect. I do want to add one thing. I know that there are some questions about the prescriptions portion of the bill. Midwives can only prescribe consistent with their scope, and the bill does not change that. This bill would be consistent with their current authorities, so I wanted to make sure that was clear.
Thank you. 2 witnesses in support.
Peter Kellison on behalf of the California Nurse Midwives Association, the sponsors of the bill. This committee has, and the legislature has seen fit to remove supervision from licensed midwives. Certified nurse midwives are advanced practice registered nurses seeking the same parity and authority. I'm going to turn the majority of the testimony over to 2 witnesses who will speak briefly.
Thank you.
Good morning. My name is Linda Walsh, and I am the president of the California Nurse Midwives Association, which is the state affiliate of the American College of Nurse Midwives. In considering AB 1306, it's important to recognize the strengthening of the profession of nurse midwives over the past 60 years. We have grown from a small group of public health nurses with additional training in midwifery to a national leader in women's health care. Certified nurse midwives, or CNMs, are now educated in graduate education programs leading to the master's or the doctoral degree. And we have 3 of those programs here in California: UCSF, Cal State Fullerton, and San Diego State. The Accreditation Commission for Midwifery Education has been recognized as the programmatic accrediting agency for nurse midwifery education programs since 1982. The American Midwifery Certification Board administers a rigorous certification examination that tests for entry-level competence to practice, as well as the recertification program that ensures maintenance of competency throughout the CNM's career. We continue to work closely with our OBGYN colleagues to ensure that women receive care in a health system that provides for the appropriate level of care. In 2011, ACOG and ACNM published the Joint Statement of Practice Relations, a document that notes, quote, OBGYNs and CNMs are experts in their respective fields of practice and are educated, trained, and licensed independent providers who may collaborate with each other based on the needs of their patients. This relationship with ACOG provides a seamless system that fosters the use of consultation, collaboration, and referral in order to ensure that the patient receives the necessary level of care. Barriers to practice related to the supervision requirement come at a time when we already have a shortage of OBGYN providers.
Okay.
There are 9 of 58 counties that have no OBGYN providers. 36 additional counties have a ratio of OBGYN physicians per female population below the national average. Removal of supervision will eliminate some of the barriers associated with the supervision requirement, thereby increasing the number of CNMs available to serve women in the state.
Thank you. Next witness.
Hi, my name is B.J. Snell, and I'm a certified nurse midwife that works in an out-of-hospital, nationally accredited and state-licensed freestanding birth center. I'm here representing the California Birth Center Association. There are 8 state-licensed birth centers here in California, with others currently under development. Birth centers are an innovation that in the delivery of care to healthy childbearing women and families. Most pregnancies and births are completely normal physiologic events, and as such do not require medical management. In California, there was a savings of $1,163 per birth in a birth center. According to the CDC, California realized a savings of $1.6 million based on 2013 birth center data. Cesarean sections are costly, both financially and for long-term health. Women receiving care in birth centers have an average cesarean section rate of 6%, whereas the national average with traditional care is 32%. Major health insurers contract with and reimburse certified nurse midwives and birth centers independently for pregnancy and well-woman care, including Medi-Cal and Medicare. Medical malpractice insurance is available independent of physician supervision at the same level as our physician colleagues. Nurse midwives practice in and own birth centers in California, and we have found physician supervision very difficult to attain. In addition, nurse midwives cannot attain access to hospital privileges without the physician's supervision. While there are many physicians that would welcome a joint practice with a nurse midwife, they are restricted by their malpractice insurance because of the supervision language. Supervision also restricts appropriate care for patients by requiring a physician to sign orders for medical supplies and medications that are needed. Removal of supervision language in AB 1306 will permit nurse midwives to order supplies and medications under their own signature. The midwifery model of care is distinct from the practice of medicine and nursing. Removal of physician supervision language will not change the scope of midwifery practice, but will allow for increased access for women and innovative health systems like freestanding birth centers to develop and thrive, saving the state millions of dollars and improving the health of women in California by lowering cesarean section rates.
Thank you so much. I'm going to exert a privilege and actually move the bill myself. Others in support?
Thank you. I'm Charles Griffiths, PhD, certified registered nurse anesthetist from Los Angeles, and the president of the board of directors of the California Association of Nurse Anesthetists. And I strongly support AB 1306.
Thank you. Name and organization. Thanks.
Karen Karp, practice director for the California Association of Nurse Anesthetists. OB is my practice specialty. I work with many certified nurse midwives. They're truly experts in their field, and I strongly support AB 1306.
Thank you.
Thank you.
Madam Chair and members, Juan Thomas from the California Medical Association. We did have an oppose unless amended, but as the author and the sponsor said, we're working together. They've taken some amendments already, and we look forward to working with them more. Thanks.
Thank you.
Christy Weiss on behalf of the California Association for Nurse Practitioners in support.
Thank you.
Nina Weiler-Harwell with AARP California in support.
And David Gonzalez on behalf of CAPCHI. We are supportive. We're still getting some feedback from our members, but we'd like to continue to work with the author and his stakeholders on moving this forward. Thank you.
Good afternoon, I think now, right? Roxanne Gould, American Nurses Association of California, in strong support.
Kelly Brooks on behalf of the Association of California Healthcare Districts. We're also in support.
Good.
Roberta Frank with Best Start Midwife Services in San Diego in strong support.
Karen Rosley with Best Start Birth Center in San Diego, California. Strong support. Thank you.
Mary Davis, Sonoma, California, citizen of California, and I strongly support this bill.
Hannah Bronsky-Pena. I'm a master's student in the School of Nursing Nurse Midwifery program at University of California, San Francisco, and I'm in strong support.
Brian Toon, CRNA, DNP PhD Program Director of the Nurse Anesthesia Program at National University. I'm in very strong support of this.
Thank you.
Eric Robles, United Nurses Associations of California, ASME in support.
Thank you. In opposition, anyone would like to speak? Don't see anyone. Committee members? Yes, Ms. Baker.
Thank you. Thank you, Member Burke. I'm supportive of so many provisions of this, and I appreciate you addressing the issue with respect to prescriptions. We spoke ever so briefly about it in advance, so I appreciate your addressing that up front, although I heard a conflict. I may have been mishearing, but it looks to me from the bill that the prescription ability is changed and that it can be without any physician supervision. And maybe it's not what so that's the part I'm having trouble with, is that prescription scope. I understand you're working with the CME. perhaps that's one of the areas that you're doing. Can you address that, please?
Yeah, absolutely. So I think supervision can be misleading. Right now, I think the inclination is to believe that what supervision means is there is someone there on a daily basis signing off on midwifery orders or prescriptions. That is not, in fact, the case. Midwives do prescribe, and they do their processes, and then at the end, at the completion, most people a lot of midwives never even see the supervising doctor, haven't seen them for years.
I understand.
So supervision gives the impression that there is someone physically present, where there is a lot of cases not. Most cases, most midwives do not see their supervising physician, nor does that supervising physician really has ever seen the patient.
Okay, thank you. And that is certainly understandable. And again, I may have misheard, but I thought one of the witnesses says that this actually allows them to do more with respect to prescriptions. It might just be my rudimentary reading of the bill.
Did anyone say
No? Okay.
No.
Thank you. I appreciate that. And I appreciate that you're working with CMA to address that particular provision as well. I'm going to support the bill today. A little bit of reservation because of this issue, and I withhold the ability to reassess as it makes it to the floor. If they haven't been able to resolve some of the issues that we've discussed previously offline, we'll talk again, but I appreciate you working on this.
Thank you.
Well, thank you very much. This is a wonderful bill. I strongly support it. I carried the bill 2 years ago for licensed midwives. My youngest 2 daughters were delivered by a midwife. I recommend that to everyone. No offense to the doctors, but midwives know what they're doing, and they would always be my pick. So I think this is really a great step forward, and appreciate you bringing the bill to us. I made the motion. I think we got a second. Are we ready to vote, or do you have a question? Okay, it's due pass to appropriations.
Bonilla.
Oh, you want to close?
No, I do. We just wanted, we are working with CMA, and I think we all would like to thank CMA for being so open to working with us. They've been great, so thank you. I respectfully request your aye vote.
It's wonderful.
Bonilla.
Aye.
Bonilla, aye. Jones.
Aye.
Jones, aye. Baker.
Aye.
Baker, aye. Bloom.
Aye.
Bloom, aye. Burke.
Aye.
Burke, aye. Chang.
Aye.
Chang, aye. Dodd.
Aye.
Dodd, aye. Eggman. Gatto.
Aye.
Gatto, aye. Holden.
Aye.
Holden, aye. Mullen. Ting. Wilk. Wood. Wood, aye.
10-0, the measure's out.
Thank you.
Congratulations. Thank you.
Thank you.